We are live. I hope you all have a great meeting.
Thank you.
Thank you.
Okay. I'd like to welcome everyone to this meeting. This is a meeting of the Homeless Initiative Advisory Committee for January 29th, 2021. We do have some new members, and I would like to introduce them and have them each just say a few words about themselves. And if I mispronounce your name, please correct me. Sarah Copley.
Good morning. I'm Sarah Copley. I'm a program officer with WNC Bridge Foundation. My two focus areas are wellness support and our strategic grant initiatives. And I'm really thankful to be joining this committee and learning from the housing experts.
Jason Desai.
Yeah, good morning. This is Jason Desai. I work at Mission Hospital. I'm new to the community. I've been here less than a year, so just excited to be part of this committee and get more engaged in the community. Thank
you. Tara Mccracken.
Hi, I'm Tara Mccracken. I'm the Director of Workforce Development at Goodwill, and we focus on employment and education opportunities for individuals in the community. So I'm looking forward to working here.
Great.
Okay, I'm counting pictures here. Should we have 14 members, right? So eight
that's
would be a
correct.
quorum?
Yeah, we don't have a quorum yet, so if we want to just go ahead and do a roll call of those present, and as other folks join in, we can acknowledge them, and I'll check. Go ahead.
Well, wait a minute. We have a lot of staff here also, don't we?
We do. We do not have a membership quorum just yet. We've got 1, 2, 3, 4, 5, 6. We've only got 7 currently.
Okay, so we need 8 for a quorum.
We do. We need 1 more for a quorum.
Okay, well, why don't we go ahead and take the roll as we have it now? Christina, can you do that?
I'll take care of that, Christina.
Okay, all right.
Sarah Copley, we've got you. Jason Desai. If you could just, when I call your name, if you just acknowledge, please. Jason
Yes.
Desai.
Present.
Elliot Diaz. Amy Hobson. Tamia Jones.
Here.
Great. Eileen McMahon is here. David Nash. Tara Mccracken.
Here.
Tim McEllier. Parker Smith.
I'm
Parker's
here. I'm on the phone.
Okay, great. Thank you.
Yeah.
Okay. Joel Steininger.
I'm here on the phone.
Okay, great. Randy Stout. Meredith Schweitzer.
Here.
Great. And Jennifer Teague.
Here.
Great. Okay, Madam Chair, we have a quorum now, so we can certainly proceed.
Okay, great. Okay, so obviously this is an online meeting. If everybody would keep themselves muted unless they are getting ready to talk, that would help a lot. I think we also have an option. This is being recorded. This is a public meeting. We are a public body, so we are subject to the public meeting law, which means that this is being recorded. And that comes into play in our future work as well. I think everybody is probably fairly used to online meetings by now, so just do what you normally do. You know, unmute yourself if you want to talk, or raise your hand and I'll try to call on you. So our first order of business, since we do have a quorum, is the consent agenda. Everyone should have received a copy of the minutes in their notes. That is the only item on the consent agenda. So can I have a motion that we approve the consent agenda? Anybody? Raise your hand.
I make a motion to approve the consent
Please.
agenda.
Oh, Meredith. Okay, thanks. Do we have a second?
Second.
A second. This is Joelle.
Okay, thank you. All in favor? Raise your hands or say aye. Aye. Okay.
Yeah,
Any
actually,
objections?
yeah, we need to do a roll call of the vote. So I'll just go through everybody's names again. So,
Okay, all right, great.
Sarah.
Approve.
Yeah.
Yes.
Jason.
Approved. Yes.
Elvie is not here. Amy Hobson, are you here yet? Not here. Okay. Tamia Jones.
Approve.
Eileen, well, you can't vote yet,
Here.
just yet. Okay. Yeah, Tara.
Approve.
Tim McEllier, are you here yet? Okay. Parker.
Approve.
Joelle.
Approve.
Meredith.
Approve.
Jennifer.
Approve.
Thanks, everybody.
Okay. Our next item of business on the agenda is the ESG's CV2 funding. We did receive another series of grant proposals based on HUD funding due to COVID issues, and the finance group, the finance work group met, went over the funding requests, and made recommendations as to funding for each of the organizations which made a request. You have a copy of the request and the allocated funds as part of your materials that were provided to you online. I will mention that we did have requests for about $500,000 more than what we actually were able to give out, which necessitated reductions in what certain organizations had asked for, which we never like to do, but there's only so much money we have, so we have to do that. So Brian can go into more detail on that.
Yes, so we received a number of applications. This was emergency solutions grant, money specifically for response to the COVID pandemic. And so we received applications for almost every activity type, except for HMIS, which city opted not to apply. But some new applicants in the mix. We were really excited to see that. As Eileen mentioned, we had a little over $500,000 in applications than we actually had funding to distribute. So I want to make sure that we acknowledge the finance work group members who really put in an extraordinary amount of time and energy examining these applications. There were some really tough decisions that had to be made. So we got it done. This is a really significant infusion of dollars into the community, in particular around rapid rehousing. We did have an application from the Sunrise community for some street outreach. This is the first time we've ever received a street outreach application using ESG dollars. So we're certainly excited about their participation. So Emily, is there anything that you want to add before we proceed to taking any questions?
Sorry, I shook my head. No, nothing from me.
Okay.
Yeah.
Okay.
Great. Are there any questions from the group at all? Okay.
I don't really have any questions, Brian, but I just wanted to say I really commend all of the applicants for their requests and forward thinking and vision for how to support individuals in our community. And also appreciate the staff and the committee members that spent time going through them and really being thoughtful about how we were going to allocate funds.
It was a really lively discussion. Lots of hard work and good thinking happening on this round.
Brian, I just wanted to share as well how much Homeward Bound appreciates the support and the work that was committed to this process. I know it's, again, to speak to what you just mentioned, there were some hard decisions, but we really appreciate the continued support of this group. So
Thank you. We appreciate you.
I would also like to recognize and welcome Kim Roney. Kim is newly our city liaison. Is that the correct thing to say? So she will be helping us and facilitating communication with the powers that be in the Asheville City Council. So thank you for coming.
Thank you, Eileen.
And welcome. Our next agenda item is a data update from Emily.
Actually, yeah, we need to get a vote on the approval.
Oh, I'm
of
sorry.
the
Okay.
work group recommendations.
Yes, okay.
Yeah.
Can we, I apologize for that. Can we have a motion to approve the recommendations of the finance work group? Anybody?
This is Joelle. I motion to approve.
Thank you. Second?
This is Sarah Copley. I second.
Okay.
Okay.
All in favor? And we
We'll-
need a
we'll
roll call vote?
Yeah, we got to do a roll call vote. So Sarah,
Approve.
Jason,
Approve.
Amy Hobson,
Approve.
Tamia Jones,
Approve.
David Nash,
Approve.
Tara,
Approve.
Tim McElroy, are you here yet? Parker Smith,
Approve.
Joelle,
Approve.
Randy, Meredith. We can't get a vote from you, and I'm sorry, Tamia. You guys had an application. We shouldn't have taken a vote from you. So sorry, Jennifer.
Approve.
Okay, great. Thanks, everybody.
Okay, so now we can go on to Emily with her data update.
The most exciting part of the agenda, I'm sure, is how all of you feel about this, is how I feel about this. For folks who are new, I'm happy to talk about this longer than you want to talk about it offline if you'd like to do that. But we, as a continuum of care, we're required to use a homeless management information system, HMIS, and that captures client level data about how many folks are homeless in our community, what their demographic characteristics are, how they use homeless services in our community, how long they stay homeless, when they exit homelessness, do they return to homelessness, really captures a lot of data. But that data is dependent on the quantity of participation that we have across the community. It is often required by public funders, not often required by anyone else. So agencies that don't take public money don't always participate in HMIS. Sometimes we have agencies that participate in HMIS with some of their programs, but not all of their programs. So certainly part of our goal is to continually improve the quantity of data that we have, quantity of participation from homeless service providers across the community. And then we also, of course, always want to be improving the quality of data that we have so that we really are able to meaningfully analyze what's happening with homeless folks in our community. So quick update on HMIS is that we do have increased participation since we met last. We now have Salvation Army in HMIS. We have ELIDA in HMIS. That may have been happening when we were together last, and I'm not exactly sure. And as of next week, we will have Haywood Street's respite program participating in HMIS. So good step forward on that front. And then we have 4 more programs that are on the way. Sunrise, because they received that ESG CV award that you all just talked about, they will be participating in HMIS for their outreach activities. And then we also have a great federal update. HUD BASH, as probably a lot of you know, is a federal partnership between HUD and the VA to provide supportive housing for veterans. And each of those federal departments has a required data system, and those data systems don't talk to each other, but they have figured out at the federal level that that's actually pretty important. And so there is a patch coming our way to be able to import that HUD-bash data from the VA system into HMIS. So we don't have that yet, but that is in the works at a high level. That'll be coming soon. And then really constructive conversations with VIA about their TCLI program and WNCAP about their HOPWA program. So I think both of those should be jumping into HMIS in the next few months. So again, really good step forward on the quantity of data. Certainly always opportunity to improve our data quality. We're working on that. And then last thing on data is that we have a number of HUD reports due right now. So today is the submission deadline for the longitudinal systems analysis report for the 18-19 fiscal year and the 19-20 fiscal year. If I look very tired, it's because I am, because this has been a really, really big push to get those reports done. But that'll be a good thing to finish. And then coming up in March, we have the system performance measures that are due also to HUD. And then the point in time count, which we'll talk about more in a bit, will be due probably at the end of April. Eventually, my hope is that we as a committee can really deep dive into those reports and what they mean for us as a community. I think because they're all retrospective reports, so they're looking at our historical data, of course, and because we haven't had a big quantity of data, I think the usefulness of those reports is pretty limited for this particular cycle. But I think going forward, they will have good substance that we can really look at and do some good analysis on as a committee and as a community. So that's it for me on data. I'm, of course, happy to answer any questions if y'all have them.
Questions for Emily? Go ahead.
Yeah, Madam Chair, I'd like to inquire, especially the new committee members, if it would be beneficial for you guys, for me and Emily, just to do kind of an information session to explain some of this, some of these acronyms and technology, and just, you know, some of the peculiarities. So for new members in particular, and for you know, old timers, you know, current people who have been on the committee, you know, we'd be happy to facilitate that discussion. And Councilwoman Roney, if you'd like to be part of that, we'd be delighted to include you. So is that something that you guys feel would be beneficial for everybody, just to try to manage the vertigo you're probably experiencing on the learning curve right now?
I mean, I think that would probably be good. I think I would like to do that as well. So.
Okay, great. I'll follow up with everybody offline and see if we can schedule a time to do that. So, great.
Okay.
I don't have any
Anything else?
questions. Yeah, sorry, I don't have any questions for Emily, but I just want to really say a shout out to her for her work, and also Brian in this work around HMIS. From my understanding, it's been a pretty large effort to try to get so many people into the system and to really be able to accumulate this data, which is really important in the driving vision forward. And I just really think that that's a huge testament to the work that she's doing, and just wanted to make sure to recognize that.
Mm-hmm. Yeah, I agree. We have much better participation now than we did even when I started, in terms of you know, organizations that are providing services that are also participating in these systems at this time. So thank you and good work.
Brian and Emily, this is Sarah. Also, I'd like to suggest, if you all can offer that training, if you wouldn't mind letting me know, I'd like to invite some other philanthropy folks, because there are 4 funders right here in Buncombe County that could have a big impact. And I think just our level of understanding what is needed and some of the historical data, so that they can make decisions going forward, can only help.
Mm-hmm.
That's all music to my ears, Sarah. I would be happy to say that.
Okay, good. Well, I realize, you know, sometimes just getting a lot of information can confuse people, but I think in this kind of targeted instance, particularly because this is involving federal funds, it would really help spread the field, honestly.
Yes, sure. We're happy to do that. I think that's a great idea.
Mm-hmm. Okay. Next agenda item. Back to Emily and Brian, staff updates.
Anyway, you want to talk a little bit about Code Purple? You have really done the lion's share of the work around that particular issue. So I'll let you kick it off with that.
Code Purple, another thing I could talk to you about until your ears bleed. So certainly, let me know if you want me to stop. But Code Purple, as you all know, is a longstanding community practice where emergency shelters extend or kind of waive their policies, their typical requirements, and exceed their typical capacity to get folks inside when it's 32 degrees or below. It's really survival oriented. It's been a good community partnership for a long time, voluntary participation from agencies, but really a good widespread practice. This year, because of COVID, we did not have a shelter that was able to participate in Code Purple at all in their typical way. All of the shelters in our community have been requiring negative COVID tests for entry. And so that's the turnaround time on that is not feasible for a day of Code Purple event. So we went into the winter with no Code Purple option available, which, doesn't work, of course. So we were able to work with the rescue mission on a creative alternative. They were willing to run Code Purple if we could find an offsite location so that they weren't sort of mixing populations with folks who had been tested at the rescue mission and their regular shelter population. So starting December 1st, we have had Code Purple operating at First Unconditional UCC downtown, which has been wonderful. Those guys have been really fantastic to work with, really willing to come to the table and bring their resources to bear on that. A great community partner. Rescue Mission has been a great community partner in this. It's certainly been a heavy lift for them to run an offsite operation that's really logistically complicated. And so far, so good. It has gone very well. So capacity there is for up to 30 men and up to 20 women and children. And so far, since December 1st, we've had 44 nights of Code Purple, including tonight. And as of Wednesday, I don't have data from last night yet, but as of Wednesday, 271 unduplicated people have stayed there for a total of 1,405 bed nights. So really impactful. I think, certainly what we want to be doing as a community is ending homelessness so that people don't need Code Purple. That is the goal, is that we really move beyond the need for Code Purple, but that's not where we are yet. And we've got to, be sure that people survive in the meantime. So it's been really well utilized. I think it has been overall just a great success. I would say, Meredith might want to talk about this later, but along with what's happening at the Red Roof Inn that Homeward Bound is doing, I would say Code Purple is the lowest barrier shelter in our community right now, really providing good access to folks who don't otherwise come in for shelter and working really just empathetically and creatively with those folks. So overall, I think it's going really well.
Okay, any questions for Emily on that? We don't have to, we can do them all at once. How about the point in time count? You want to go into that?
Yeah, sure. So a point in time count was conducted Wednesday evening and into early yesterday morning. We had really significant volunteer participation again this year. Lots of new folks involved, and that was great to see. Obviously, the pandemic affected everything on this, and I was pleased to see that we had as much volunteer participation as we did. Emily and I took a lot of input that we got from volunteers from last year's count, just feedback on how we could do things differently and better. I think in particular, we did a much better job of mapping the community and really identifying places where we needed to deploy extra personnel this year. I think we did a pretty good job on that. As with every year with the point in time count, it's an inexact art form. Every community is required to do it more or less similarly, but it's a challenging thing to get done even under the best of circumstances. So, I think the unsheltered count, it's just particularly tricky to do. The sheltered piece of it, it's easier to do. We just get a data dump on that. But I think overall it went pretty well. Certainly, Emily and I have already had some conversations about the quirks that we experienced this year and just how to address some of those for next year. But it's all but the data entry and analysis has been completed at this point. And I'm thankful that the weather didn't become as nasty as anybody had thought that it might. So we're happy to scratch that off the list for this year. So. Emily, anything you want to add to that?
Just a couple of things. One is that we had 44 volunteers. Sorry, I have an echo. I can't tell where that's coming from. 44 volunteers, which is great. In the past, it's really been Homeward Bound and the VA who have done a lot of the heavy lift on that, and both of those organizations really participated this year also. But it was great to sort of have a wider net and broader community participation. And the point in time has to be reported to HUD out of HMIS, and HUD hasn't set the due date for that yet, but it is usually the end of April. I'll certainly try to get it done sooner than that. But it's a matter of gathering those survey forms from folks, shelters that are participating in HMIS. We can just grab that data right out of HMIS. That's easy, but places that are not, like Helpmate, for example, is not able to participate in HMIS by statute because of the confidential nature of their work. So they'll complete paper forms for the folks who stayed there that night. So I'll collect all of that in the next week and then start doing that data entry. But I guess I wanted to say two things on that. One is yet another plug for HMIS participation. It does make process work like the point in time count much easier when we have agencies participating. And the other is just a timeline reminder that usually it is around the end of April that we have the results, but hopefully we'll be able to do that sooner. But overall, I think it went very well. I would say in my time in our community, it's the best point in time count that we've had. I think that we had really great participation all around. I do think it's possible that we'll see an increase in the unsheltered count because we had such specific methodology. That's, the count is kind of only as good as the way we execute it, in addition to whether or not folks are willing to talk to us and how we're able to find them. But I think that we might anticipate an increase in that. We may certainly also have an increase just because times are hard and folks are homeless. So there won't be a good way for us to differentiate between causes on any of that data, but I would not be surprised if we end up with a higher unsheltered count this year, partly because of that improvement in methodology.
Any questions? Let's go to the Red Roof Inn.
I actually have a question if it's appropriate at this time.
Sure.
Are the school systems included in the point in time count?
So great question, Councilwoman Roney. The McKinney-Vento, the educational department definition is different than the HUD definition. So for homeless families with school-age children who are doubled up with family or friends or staying in motels that they're paying for with their own resources, by statute, we're unable to include those particular families in the count. However, we do coordinate with both the Asheville City Schools and Buncombe County Schools McKinney-Vento homeless representatives to make sure that if they have folks who do meet the HUD definition, who are sleeping in their cars or who are sleeping outside, that we get those folks counted. So, we make every effort to collaborate with both ACS and Buncombe County schools. So, but it's one of those quirks of federal definitions of homelessness that unfortunately a lot of people are left off the list. I think the last discussions that we had with those liaisons, I want to say there were probably 600 plus homeless kids, between the two systems right now, which is just really alarming.
But a really small number of those folks meet that HUD definition of literal homelessness. So a really small number of people would be staying in a shelter or a car or something like that. I talked to both of them earlier this week about the point in time count participation, and Jessica at Asheville City Schools said that she didn't have anyone who is currently literally homeless. And Shannon at the county said she had a handful, maybe 4 or 5.
Yeah.
But she was going to do those survey forms with those folks, so they will be included in the count.
Yeah.
Thank you so much.
That's a great question, Councilwoman Roney.
Okay. Red Roof Inn.
Yeah,
Do you have a report on that?
Yeah, so our operation there, our collaboration with Homeward Bound, and of course our corporate partner, Red Roof Inn and Axis Security, is ongoing. As of last Friday, I think there were 65 or 66 people currently in 60 rooms out there. About 134 have been served to date with an average length of stay, probably, I don't know, Emily, probably pushing 120 days now, I think, something like that. Just our gratitude to Homeward Bound for, continuing this operation. I know it's been a real stretch for them, just in terms of keeping it staffed and just making sure that everything runs smoothly, and their partnership with the Asheville Poverty Initiative to ensure that folks get 3 meals a day out there. We're having some discussions with Homeward Bound about sort of changing up some of the operations there. We've been in dialogue with them, just based on what their experience has been over the last going on 10 months now, 9 months now. Just trying to figure what tweaks we can make to continue the operation and make sure that they don't get stretched too thin and all this. This is, as you guys know, it's for really vulnerable, unsheltered homeless folks who are at risk for COVID-19, increased risk for COVID-19 because of age and or underlying health conditions. So it's really been a vital piece to keep some of our most vulnerable community members out of harm's way. In December, we finally managed to get our application for FEMA funding in and our initial reimbursement request. The city of Asheville has been fronting 100% of the operating expenses for this, which are significant, in anticipation of getting FEMA reimbursement for this. And it's eligible for FEMA reimbursement at 100%. So eventually the city will get made whole on this. The FEMA application process and reimbursement process is complicated. We received a week before last our first FEMA calls request for information, which is clarifications about our application. So I've been really busy responding to 12 questions, pretty significant questions they had about that, just to make sure that we keep that ball moving forward. We have an external consultant that's really experienced working with FEMA, helping us on that front. So it's moving along, and just we're grateful for everybody's partnership on that. Just hats off to Homeward Bound. They've really been doing a lot of heavy lifting around this. So it continues to operate. Last week, council approved a budget amendment and authorization to extend the contracts through the end of this fiscal year on June 30. So Councilwoman Roney, thank you so much for that. And we'll just keep it going. The good thing about FEMA is they had been granting their authorization every 30 days for this to be an eligible expense. In the middle of December, they said our authorization for this is good through the end of the emergency declaration. So we don't have to white knuckle it every 30 days going, okay, we're going to get another month's extension. So that leaves me sleeping a little bit better during the last 3 or 4 days of every month, waiting for that approval to come through. Lots of communities are doing this. It's really complicated. But we've been operating this since May 11th of last year. It's made a huge difference in the community for our really, really vulnerable folks who are experiencing homelessness, who are at really significant risk for COVID-19. So it keeps on going on. So.
Brian, if it's okay, I'd love to just piggyback on that a little bit. I guess the biggest piece for us at Homeward Bound is recognizing that low barrier shelter works. if you have the right support in place, it can be very successful, and that's been really exciting to see. And as you mentioned, it's, we've had over 60 people on average every night. And we've got a number of folks who've had quite a bit of tenure in that model. And we've been able to house, I think, in upwards of 25 people now directly from the hotel model. And what's another great benefit of having this population in one area is that, or at least, in this one non-congregate setting, is that whenever we need to link them with services and provide support, we know exactly where to find them. In that regard, it's made our work so much easier as well. And so it's been a great success in terms of a public health standpoint, and just being able to do the work that we do in terms of connecting people to housing solutions. So thank you for the support, and we will continue to move forward. I know, again, you mentioned that there's an extension through June 30, and we'll continue to work through some of the issues that we've talked about in terms of support services and getting those nailed down. But overall, it's been an amazing thing to watch, and I'm so glad that we've been able to partner with you all on this initiative.
Okay. Thank you, Meredith. Madam Chair, are you still with us? Well, until Eileen jumps back in, I'll go ahead and provide the Continuum of Care update. Our Continuum of Care funding largely supports permanent supportive housing efforts in the community. The renewal funding supports probably about 160 or 170 households, housed primarily with efforts from Homeward Bound. HelpMate gets a little bit of that money for some rapid rehousing efforts. Last year, obviously, the pandemic squashed the normal, what they call notice of funding availability, the NOFA competition for Continuum of Care funding. The Department of Housing and Urban Development in December decided to flat fund all current recipients of Continuum of Care funding for the 2020-21 grant year. And then the competition for the 21-22 grant year has already been opened. The city of Asheville serves as the Continuum of Care lead entity, which we can cover this in an offline informational session, but our responsibility is to coordinate all the community processes that are required for that $1.3 million of funding we receive annually to maintain our homeless management information system and to coordinate the composition of what's called the consolidated application, that is our community's kind of an overview of how the community is approaching homelessness system-wide. There will be a competition this year. Again, this is a competitive funding cycle. We are competing with 406 other continua of care across the country for these dollars, and it is based. Our award every year is increasingly based on our system performance measures that Emily mentioned. So our work around getting better and more quality data and improving each of those data points is really critical to this particular funding. So we got a little bit of a reprieve last year. I always say that the submission of the consolidated application, that every human being needs one near-death experience every year, and the submission of the consolidated application is my near-death experience every year. So I was glad to get a pause last year, but we're back on for this year. And as we get more information on the timeline for the actual submission of applications and the submission of the consolidated application, I'll keep you updated. Our finance work group will again engage to review those applications at the local level. So stand by for more information, but there is a competition happening again this year. Did our chair return yet? Eileen, are you there?
Madam Chair, you're muted.
Am I back?
Yeah.
Can you hear me? Okay.
Yes.
All
Yes.
right. Okay. We are doing very well on the time for our agenda, so don't hesitate to ask questions if you have any. If not, our next item, 2021 priorities.
Actually, Madam Chair, we've got a COVID-19 planning report from Brian.
I'm sorry, I missed that. Okay.
Yeah.
Let's go ahead with that. Okay, is Brian here? Is he one of the telephones? Okay, great. Okay,
So,
go ahead.
In terms of COVID-19, we've been moving forward on multiple fronts, one of which is on testing. And so we've engaged a vendor, several different entities that are doing homeless COVID-19 testing, both for people who believe they have symptoms, as well as just general population screening. The other thing that we're moving forward with is planning for vaccination of the population. I have a call later today with the state COC leads to go through best practices for setting up a plan for the community. We have a regular biweekly call with Dr. Mullendorf from the Buncombe County Health Department, where we're going through and discussing both our testing issues and planning for vaccinations and general monitoring of the population for COVID-19. We have agreed with her that for this population, they won't be using the mass vaccination centers that most of the people on this call will be going through because of the nature of the population. We'll be doing outreach to them. So part of what the plan we'll be developing is to create vaccination events specifically targeted at the homeless population where we can reach them where they are. And so that plan will evolve over the next 3 to 4 weeks. And by the next HIAC meeting, I should be able to give you an update on the specific plans for vaccinating the population. In addition, we're moving forward with efforts to try to get all of our homeless services providers staff vaccinated because of their critical role in the community in caring for this population. Currently, both the staff and our homeless clients are in phase 3 of the state's 5-phase plan. So right now, Buncombe County is in phase 2, which is those 65 and older and healthcare workers. So we won't go, our staff and homeless clients are not scheduled to be vaccinated until we start into phase 3. One of the things that's slowing down the progress from phase to phase is that there, as you read in the paper, there's a limited supply of vaccine available. I think yesterday on our call, we identified there's just a little over 2,000 new doses that will be available for first-time vaccinations in the county next week. And there's probably about 50,000 county residents who fall into that current phase 1 and phase 2. So you can see at that rate of vaccinations is going to take quite a while to get to that population. Now, the good news is that more vaccine is supposed to be on the way. Again, we're supposed to start to see increased supplies coming through. And so as that happens and vaccination ramps up, we should get through phase 2 sooner and be able to move in effectively into phase 3. In the meantime, for our homeless service provider staff, we've got an arrangement with Mission Hospital now that is they're doing vaccinations for phase 1 and 2 eligible residents. If there is extra vaccine available during the day because of cancellations of appointments or people who otherwise don't want to receive the vaccine that day, we've created a wait list of homeless service provider staff that they can call up, because the goal from the state is to get all the vaccine administered as soon as possible. So our priority is phase 1 and phase 2 individuals, and we've now created a backup list, standby list for homeless service provider staff, which would normally be in phase 3. So we're doing our best to try to get through all of the population being vaccinated as soon as possible. I think all of us recognize the homeless community in general has difficulty in adhering to the 3 W's, which we all should be. I was doing the point and count, time count at the Code Purple shelter on Thursday evening, and it is obvious that they have difficulty maintaining social distancing, wearing a mask, washing their hands regularly. So while we have not had a high incidence rate of COVID-19 in this population, they are extremely vulnerable to an outbreak. So we recognize that. We want to try to get them vaccinated as soon as possible. Do we have any questions?
Does everybody know how to get on the backup waiting list?
Yes, we've communicated with all the homeless service provider executive directors and some of their key staff, and have collected up standby lists from them. And those have already been distributed to Mission Hospital.
Questions, comments?
I was just wondering if someone could maybe give an update regarding the testing too. I understand there's been a plan that was updated yesterday.
Emily, you want to talk specifically to the testing?
Yeah, you just mean who's getting tested where?
Yeah, and that all of the work and culmination has developed an actual testing.
Yeah, we've been talking about testing for a long time. It took a really long time to get traction around this for a number of reasons, but we have a great testing partner. Senesco's community lab, with some support from Dogwood, has really jumped all in on testing in the homeless service system. So as of next week, we should be all set with either weekly or bi-weekly testing at all of our providers, and including Code Purple. And hopefully we'll have a regular 2-day-a-week opportunity for folks who are unsheltered, or anyone in the homeless service system who is symptomatic or just needs a test for whatever reason, kind of an open time, catch-all time for other folks in the system. But they are doing weekly testing at Trinity Place, Salvation Army. We'll be doing Code Purple, and then bi-weekly testing at the Red Roof Inn, Helpmate, and Haywood Streets Respite. So the rescue mission didn't want testing from them because they have Appalachian Mountain Community Health Center doing testing there 2 days a week. So it felt like they had their testing needs met, and ABCCM, because of course they have so many veterans at the VRQ, they have testing available through the VA Medical Center, and then also have a relationship with Winches when they need other folks to be tested. So again, as of next week, I think we will have good surveillance testing and good testing capacity for anyone who needs it in the homeless service system.
I also should mention that at the VRQ last week, the VA hospital did administer vaccines to all of the veterans and residents there who wanted to get the vaccination done. So the first shot was given to a number of people out there, and I believe they had like a 60% uptake rate amongst the veterans at the VRQ.
Emily, I had a question about the schedule for the testing. Is there a way we could just get a copy of that so we could circulate it within our organizations, just that daily testing schedule each week?
You mean which agencies are being tested when?
Yes.
Sure, yeah. I have a shared spreadsheet with Senesco that has all of those details, and I'd be happy to share that with you all.
Great, thank you.
At this point, all of those testing events are specific to those locations, so not open to, you all couldn't send staff to Helpmate, for example, on their testing time. So the only, apart from that rotation, when they come to you, the only kind of open availability would be those 2 days a week that I think will be Monday and Tuesday mornings from 9 to 11, but I'll be sure to send that out when it gets finalized.
That'd be great. Thank you. I know we've been sending a lot of our folks to the rescue mission on Wednesdays and Fridays, so that would be helpful. Thanks.
Mm-hmm.
Anything else on that? Or any of the other earlier things we talked about there? Okay. This is our first meeting of 2021. It is also the last year of the 5-year strategic plan that was developed earlier by this committee as part of its mission. And I'm going to read. We do have, if any of you are not familiar with the strategic plan, you should look at it. It is on our website, and you should also know that there are a lot of materials from this commission on our website that are available to you and to the public. So from that, our duties include: 1, conducting research and investigation into issues about homelessness, including causes and effects within Asheville and the surrounding area. 2, formulate and make recommendations to local government entities and social service agencies to reduce the incidence of homelessness. 3, act as a clearinghouse for information on local homelessness issues. And 4, other duties as requested by City Council, Board of Commissioners, or as the Homeless Initiative Advisory Committee deems appropriate. Now, we have in the past also had committees working on specific items. Some of those committees did good work, some of them not so much, but we have always had working committees. Since COVID, obviously, we have had a lot of restrictions on what we were able to do as a commission and as a committee. One of those is that we have not had committee meetings, and we have not had very many meetings of this group. Some of this is due to the requirements we have to conduct public hearings. Our committees are also bound to have public hearings. And in order to have a public hearing these days, we need to go through the Asheville City, I don't want to say bureaucracy, but that's the only thing I can think of at the moment. But there is a network for conducting public meetings to make sure that they comply with the law. And that has reduced our ability to have a lot of committee meetings, or many committee meetings, and even our regular meetings. So we are here at our first meeting of 2021 with a lot of work to do and a little bit of few structural issues in terms of how we meet and get things done. I would like to, and I'm making this as just sort of a suggestion here for going forward. I mean, I think it would be good if everybody reviewed and thought about the strategic plan that is now in place and about to be timed up. Time is up for this strategic plan. See how much of it is still relevant, how much might have been done, how much has not, and think from your personal perspective and your personal organizational perspective and your area of expertise, what you would think of as priorities, anything that would be easy to get done, anything that needs to get done that might be a little bit more difficult. It would be, and I think it will be great if we do have this workshop that Brian is talking about, because I think that will help us all get updated and maybe going in the same direction in terms of the dealing with HUD and so forth and so on. And what I'm thinking, or what I have discussed with Brian, is developing some task forces. And I think a task force properly constituted might not come under the public meeting law, so that we could have more informal discussions. And what I would like to do at some time in the next, probably not the next couple of weeks, but maybe starting March or so, or when will our next meeting be? Maybe January, February?
It'll be at the end of March. I don't have the exact date. The fourth Friday in March.
Before our next meeting, I would like to make a telephone call and have a short discussion with each one of you to see what your ideas are on the direction we should be going forward in, what your priorities might be, so forth and so on. And then with Brian and Emily, sort of organize them and put them into a format so that at our next meeting, we might be able to get a little bit more organized in terms of developing a structure for going forward. Does that make sense?
Yeah.
Yeah, Madam Chair, if I might tag on to a couple of things. The
Sure.
one thing, one of the charges of responsibility that this group has, the Department of Housing and Urban Development Continuum of Care funding, which includes Emergency Solutions Grant and the overall pot, it requires each community to have a local governance body, which this particular committee is. And one of the functions of that governance group is to evaluate funding applications that come through and make recommendations to HUD or the Department of North Carolina Department of Health and Human Services, about our local priorities for funding with continuum of care and ESG dollars. So it has a compliance component that's not necessarily stated in our existing documents. The Department of Housing and Urban Development, as I mentioned in just talking about continuum of care funding, has really placed an increasing emphasis on, how we function as a community-wide system in addressing homelessness, not just with the agencies that receive continuum of care and ESG funding, but how are we doing overall as a community? And so I think this is, one of the things that, Sarah can really help us connect with, what's the thinking in the philanthropic community around this issue. And we can really sort of come up with a more comprehensive overall system-wide, community-wide strategy around ending homelessness, come to a shared vision on how we're going to be able to do that. Because that's really what the Department of Housing and Urban Development wants communities to do. So as Eileen mentioned, she'll reach out to each of you separately to get your input. But, we're in, essentially the last year of a 5-year plan that was approved by council, several years ago. And it's time to evaluate whether there's anything in that plan worth focusing on for the remaining time that we have, or if it's time to just start beginning a new strategic planning process and coming up with some very specific and measurable objectives, for the community to achieve over the next few years. So, Madam Chair, I appreciate your willingness to reach out to everybody individually and just see how we can configure a plan to move forward as a community on this issue.
Any comments, suggestions? Okay. Well, it's I've got 9:57. We still have public comment. Remind me how we were going to handle that. We did have 3 comments from the public. They also were sent to everyone shortly before the meeting.
That's right. I think, Madam Chair, we just needed to acknowledge the receipt and distribution of those public comments. I know that Emily's already responded to one of them, and I'll certainly respond to the others. So wasn't really anything that was open for particular address by this committee.
Okay. Okay. Anything else from anybody? Old business, new business? Yes?
Chair, if I may, I just want to request that since I'm the liaison carrying back and forth information between the council and between this group, that public comments can be sent to me in case I conclude those. And also,
Sure.
I am watching very closely on a personal level the work of Miriam House in Lynchburg, which their continuum of care has been, as of February 2020, has reached functional zero veteran homelessness. And I know that was a concerted effort. And when I heard in this group a conversation about what it means to have services under one roof and when people have access to all those layered together at the Red Roof Inn, it made me think of the work that's happening there in Lynchburg. So I just wanted to bring that to attention as we consider what comes next with the strategic plan and how I can be a helper.
Yeah, that's great. And one thing about this community that is kind of remarkable is that our veterans homeless population is really well resourced in this community, and that's partially due to a couple of things. We have a splendid regional VA medical center here, a really excellent VA medical center. Our Veterans Restoration Quarters, VRQ, run by ABCCM, has correct me if I'm wrong on this, Emily or Joelle, about 140 or 150 what they call grant per diem beds that are transitional housing beds for homeless veterans. So we have a higher incidence of veteran homelessness here in our community than a lot of communities do, just because of those two factors. And so, Joelle Steininger, who's a part of this particular committee, works with our homeless veterans population through the VA. Our HUD-VASH program is really active. We have lots of vouchers, the long-term rental assistance and social services support for veterans who do get housed. If only our non-veteran homeless population was as well resourced, we could be making a bigger dent in this. But I think getting to functional zero is the objective for the entire community, not just the veterans population. But there's a way to get there. And Councilwoman Roney, I appreciate your participation in this and bringing what Lynchburg's efforts are in this. There are a lot of other communities that, at least with their veterans population, have gotten to functional zero. So I think that's something we ought to set as an objective for Asheville for sure. Thank you.
I'd love to tack onto that we actually have reached sort of our version of functional zero for veterans. That happened a couple of years ago. So functional zero has a federal definition, as everything has federal definition. And we as a community are not likely to ever meet that definition because of those grant per diem beds that Brian talked about, primarily at the Veterans Restoration Quarters. So we'll continue to have an inflow of folks from other communities who are coming here for that program. And our data will continue to show that we have a high subpopulation of veterans. But because of that, we have a wealth of housing resources for veterans through HUD-VASH and Homeward Bound's SSVF program. And what that means is that we have a really good flow in our system, which is what functional zero is. It basically means that you, when someone becomes homeless, you can quickly rehouse them. So the expectation is not that people never experience a housing crisis and never become homeless, but the expectation is that your system is highly functioning and can respond really quickly to that crisis. And there are some particular metrics around that. But all that's to say that I think we do actually have, while our data will continue to look poor on the veteran front, we do actually have a really healthy system around responding to veteran homelessness. And as Brian said, we are very far from being able to say such positive things about people who are not veterans in our community. We don't have that wealth of resources for the other 60% of folks who are homeless here. But I also wanted to mention, just on a positive note, that in lots of ways, we're set up for a better 2021 than 2020, all of us across the world. But also in terms of homelessness, because of the pandemic, because of the CARES Act, we've had this huge infusion of resources specifically for housing programs. So a lot of that is with Homeward Bound, but it is also with Helpmate and Elida. Really exciting to have Elida as a new housing provider in our community for that youth population. So I want to encourage you all, as I am encouraged, that we do have good movement on the way in terms of housing folks who've been homeless here for a really long time. And I think that'll really help us sort of take a bite out of our chronically homeless population. Right now we have 220 some people on that chronic by name list. So just a big bottleneck, folks who've been homeless for years and years in our community. But because of these CARES Act resources, I think Homeward Bound in particular is going to be able to house a lot of those folks. So I think it's good timing to be looking at a strategic plan when we have new resources to work with that we just haven't had in the past.
Anything else? You have Brian?
No,
say something?
This group has just worked extraordinarily efficiently this morning.
I think online meetings sort of do that. You don't have quite as much idle chatter as you do when people are sitting next to each other. Do I have a motion to adjourn? Do we need a motion to adjourn? Should I just do it?
I'll have to go look at Robert's rules, but I think the chair has the discretion to adjourn at the appropriate time.
Okay. Well, if there's nothing else, I hereby adjourn this meeting.
Thanks, everybody.
Thank you, everybody, for coming.
Everybody.
Okay.
Thank you.
Bye.
Thank you.